Well, you clicked on this link because you want CST questions. Well, this is an extension of my playlist I have, which I kind of read questions just to give you a little, kind of catch you up to the format I have here is I will read 10 questions, and these questions are right off of the exam B, or practice exam from the CST. They always provide this, but there's always a variety of questions that they try to pop out on their website. But I'm going to read you 10 questions. Format is, I will pop it up on the screen, read it to you, break the questions down within reason, but I'll let you know what the answer options are. This is multiple choice. Pause it if you want to try to answer it, because I'm going to let you know the answers as soon as I read that question. I'm going to get through 10 questions. I don't want this to be long because most people fade away after about 3 minutes. Let's keep this about 10 minutes long, okay? Let's jump right into that. Before we start, if you can like and subscribe, or trying to get this page out to the students helps us out, helps me out personally on this YouTube page, and helps us try to get information out to students. So like, subscribe, here's a little subscribe button, hit that bell icon, all of the above. All right, no more soliciting. All right, first question, right? I'm gonna read it to you. Put that up on the screen right now, right? During which of the following surgeries is a Meckel's diverticulum typically discovered? Is it A, a hysterectomy? Is it B, an appendectomy? Is it C, a prostatectomy? Or D, a varicocelectomy? So think about it, push pause. What is Meckel's diverticulum? Do you know where that's located? Well, I do. Do some research on that. It's a commonly mistaken for an appendicitis. It's a diverticulum that's inverted, and it is a diverticulum that's inflamed and a little bit larger. So B is your correct answer. Meckel's diverticulum. Do you know what Zeckler's diverticulum is? Look that up. This is an unusual type of question that I don't see very often, but I'm going to read it to you. Question number 2, right? When preparing the STERRAD sterilization system for use in a surgical area, which of the following outlets must be available? Weird question. Is it A, the suction? Is it B, the oxygen? Is it C, nitrogen? Or D, the electrical outlet? Well, if you don't know, you stick things in an electrical outlet. Yeah, they're going to use an electrical outlet as an option. I just thought that question was weird. I've never seen that, and this was on a ASD practice exam. Do you know outlets? Do you know AC current? Do you know DC current? What those stand for? Alternating current or a direct current. Yeah, so D was your correct answer on that. Let's move on to question number 3. When you put it up on the screen. When can an instrument count be admitted? This is another kind of weird question. Is it A, if the incision is too small for an instrument to become buried? Is it B, when the surgical technologist in the circulating role becomes too busy? Is it C, if the instruments are needed in another operating room? Or D, when the patient receives outpatient surgery? Now, typically I tell students the only time you can admit a count is in an emergency. But in this case, A is your correct answer. If the incision is too small, right, you can admit a count. But I guess the key word is instruments. Instruments, right? Not a soft count, not laps, not ratex, right? So when instruments can be admitted, usually is because you're doing laparoscopic, or they're not in a cavity, or you're not going to lose these instruments, right? So A is your correct answer on that. Question number 4, we'll put that on the screen right now. A specimen obtained for frozen section is generally removed from the sterile field intraoperatively because, is it A, needs to be labeled by the circulator? Is it B, is sent to pathology immediately? Is it C, we contaminate the sterile field? Or is it D, needs to be placed in formalin solution? So the specimen obtained for frozen section is generally removed from the sterile field intraoperatively because, why are we doing that? What is frozen? Why do we need that? Yeah, that doctor needs that specimen to be sent down right away. It needs to be dry. They're going to freeze it, and they're going to splice that up and check for cancer typically, check for margins. So B is sent to pathology immediately. Otherwise, everyone in that room is just standing there looking at each other, waiting for the news. And I've been there before, right? So B is your correct answer. Question number 5. We'll put that on the screen right now. Which of the following is the most common complication of a strangulated hernia? All right, do you know your hernias? Is it shock? A, shock. Is it B, necrosis? Is it C, infection? Is it D, hemorrhaging? So what is the most common complication? If you know strangulated hernia is exactly what it sounds like. You're strangulating the vascular supply. Not incarcerated, it's strangulated. So if you cut off blood supply, ischemic, things are going to become necrotic and die, right? So that's a complication. So typically you probably want to have staplers available and get ready for a resection or a colon resection of some kind, right? So B is your correct answer on that. Question number 6. Question number 6. As I got something on my screen. Question number 6. Put it up on the screen right now. Is a steam autoclave set on prevac? So we're a steam autoclave set on prevac. The minimum temperature that it must reach is what? 200, 230, 250, or 270? And now I've gone over this with class about steam, ethane oxide. Ethane is usually a lower temperature. Steam typically is a higher in the 200s, but they break it up into 2 categories. Gravity displacement is typically about 250, and when you get into the prevac, you're at a higher temperature, and that is D, 270, typically 270, right? 27 psi, probably for 30 minutes. I've seen that on some exams. But with this question, this answer, it's 270. That's the minimum temperature you want it to be at, right? Hey, if you guys stick to the end, we're going to have a bonus question. And again, don't forget to like and subscribe. It really helps me out. Hey, put some comments down there. Spread this to your friends. Let your classmates know about it. And tell me what you guys want to see for CST. How are you reviewing out there? Because I know a lot of people are having trouble reviewing. I've talked to many people about the CST exams. I've talked to instructors how they structure classes. There really is no easy way around it. You have to study. You have to try to retain this information. Do not try to memorize. Might be a place for memorization, but in the long term, if you truly understand what they're talking about, no matter how they reword these questions, you will understand those. So, and that's my pro tip of the day. And just for that, why don't you like and subscribe? All right, stop saying like and subscribe. Come on. All right, what are we on? Question number 7? Oh, Dios mío. Question number 7. Put it up on the screen. If it's not number 7, well, we're just going to roll with the punches here. Which of the following vasoconstrictors, hopefully that's on, which of the following vasoconstrictors is used to prolong the action of local anesthetic? Is it A, heparin? Is it B, some word we can't pronounce with an E? Is it C, lidocaine? Is it D, epinephrine? So which of the following vasoconstrictors is added to the local? Yeah, this is a first day on the job kind of scenario. Epi is added to local to help prolong the duration of most medications, Marcaine or lidocaine, right? Do you know lidocaine? What and the difference between lidocaine and Marcaine is? Lidocaine is quick reaction, but a shorter duration. Marcaine is typically takes a little bit longer to react, but a longer duration. So vasoconstrictor prolongs the anesthetic. Do you know what else it does? Yeah, so it's also going to help with hemostasis. Since it's a vasoconstrictor, it's going to reduce blood loss or bleeding around incisional sites, especially trocars. Try to sew up those trocars when it's bleeding like a sieve, right? Do you know what a sieve is? Question number 8. Put it up on the screen. Which of the following surgical procedures may be used to remove a carcinoma from the head of the pancreas? Yeah, is it A, Heller? Is it B, the Whipple? Is it C, Bankart? Or is it D, Billroth 1? Now, I told students all along, every time you have pancreatic cancer, Whipple is involved, but it's always in the head, typically in the head of the pancreas, right? Looking at the other options there, Bankart, Billroth, these are all, Bankart's the shoulder, Bill Roth is really a gastrotomy, maybe stomach cancer, where you're reconnecting the duodenum to the stomach. And Heller, hell did I know? I don't know what Heller is. I want you to Google it and put it in the comments if you know what a Heller is. Is it Heller Keller? I don't know. Anyways, that was question number 8. Oh, it's right there. Heller is a myotomy procedure. It's I don't know, it's an incision in muscle. Well, that's not really a good explanation. I want to look it up. I'm not sure either. Question number 9. Retention sutures are advantageous when a patient is... So when should we use retention sutures? Is it A, pediatrics, B, some athletic patient, C, thin, or someone that is obese? The correct answer is obese, right? Retention sutures are going to prevent eviscerations, dehiscence, right? Something that has a tendency that the sutures will separate, that approximation wound closure will separate. Retention sutures with bolsters typically will prevent it going into the skin. Retention sutures are going to help prevent dehiscence the best of their ability. And that is correct. On to the next one. All right, question number 10, and stick around. I'll have a bonus one right after that, and the parathyroid gland regulates. So question number 10, put it up on the screen. The parathyroid regulates. The parathyroid gland regulates. Is it insulin, calcium, sodium, or
aldosterone?
I don't know that word.
Aldosterone.
I will sub it in. Or D.
Aldosterone.
So what does a parathyroid regulate? So this is really important. Do you know how many parathyroids we have? We have 4, right? Okay, so what does it regulate? If we suddenly don't have a thyroid, we're not going to get good calcium absorption. So it regulates your calcium throughout your body. That's CST 101, right? Do you know, if you're doing a thyroid, what nerve you have to protect? Yeah, that's a recurrent laryngeal nerve, right? Stick around for the last question, the bonus question. Before I find that question, hey, thank you for just staying to the end. But surgically map these questions, understand everything there is about it. Just expose yourself to as much information as possible. That is my advice. So the last question, bonus question, you stuck around. Here we go. Right, pretty simple question. We'll leave you with an easy one today. All right. Which of the following is true regarding the care of ratchet instruments following a surgery? Is it A, instruments should be soaked in saline? Instruments should be prepared for decontamination with curd tips up. Instruments should be opened and washed and sterilizing. And D, instruments should be sterilized in sonic washer. So, which of the following is true regarding care of ratchet instruments following the surgery? So, what should you do when the surgery is done and you're preparing instruments to go to decontamination? So, the instruments should be opened. This is C is the correct answer. Instruments should be opened, and hopefully you're spraying some enzymes on that to help with breaking down it, right? So, C is your correct answer. Kind of a weird question, but yeah. Instruments. So they're talking about instruments should be opened so all the debris can be washed away. That makes sense. So that's the key there. Open instruments. Otherwise, someone in sterile processing is going to have to do that, right? Don't put more work on the sterile processing department. All right, thank you for sticking around. Why don't you hit these videos? There's a whole playlist. Check them out. Just run them through. And I thank you for paying attention, class. As they say, as G.I. Joe, knowledge is key and knowing is half the battle. All right. Thank you for sticking around, and I'll see you next time. There's my face. There's some videos. Subscribe, like, all the above. See you next time. Bye-bye.